The Dr. Fazil TV show is brought to you by POYA, People of Yuma Health Association. The Dr. Fazil TV show is intended for health educational purposes only and complies with all the HIPAA regulations.
Nice to see you again. I've been here, I guess, after for a while. How many of you are new here, so I can give a little bit more introduction? How many of you actually new who have seen me first time?
First time.
Oh, first time. I guess you've been familiar in the clinic. So welcome to yet another episode of Dr. Fazil Show, which is a live show right now, which will be available on the Roku channel by next month or maybe before that. So I welcome you all to his show. And a little bit of introduction about me. I'll slow down because I know I'll speak a little bit fast. I'm Nadia Hanif, MD, Internal Medicine. I graduated from St. Joseph's Hospital. I'm also the president of POYA, which is the People of Yuma Health Association. And there are some billboards out there on the 4th Street and 16th, I guess, on the 16th Street. They are running with our clinic advertisement and clinic services. A little bit about POYA, which is the People of Yuma Health Association. Services which People of Yuma Health Association, POYA provides are we give services for the patient education, making sure their health is better. These seminars are one of the services which is conducted by POYA, so people are aware how to manage their health, how to live healthy, and how to maintain their healthy lifestyle. Other services which I do personally with the help of some of my team members is that we provide other community services, which is a list which we can sometimes discuss on that. And that's what we have started so far. So POYA started actually 2017 and has been doing a good job on providing patient education and its services for the community. Right now I will let Dr. Fazil take on, and he will be talking about how to stay away from the hospital. So I guess this is a very interesting topic today. I hope all of you will benefit from it. Thank you.
Thank you. Thank you, Nadia, for introducing me again. I hope everybody can hear me well. So the question is how to stay away from the hospital. I didn't say the name of the hospital. It's a general concept. The reason it is important to stay away from the hospital is that, in essence, we are saying that stay healthy, right? Because when you're in the hospital, you have to be sick. You can't be in the hospital for any other reason, or shouldn't be. We know there was some social admissions back in when I was working in, on the East Coast. Sometimes the hospital have to admit patients because they didn't have any place to go, but obviously that's not the right reason for the patients to be in the hospital. So generally speaking, the concept is that if you're in the hospital, you're very sick. Well, the whole idea of this presentation is don't be that sick so you end up in the hospital. So that's a good thing because we're promoting health. The other thing is there's a hidden downside of being in the hospital. There's some damages or some health issues can occur if you end up in the hospital, in addition to what you initially went for. So it is not just saving money for the insurance companies, but also saving yourself as well, to getting to the next level, and also getting infections from the hospital or other things which are not supposed to happen. So you can see on this side that there's a cartoon of a hospital and all the germs are there, and that's not good, and that's the fact. So my disclaimer before I move any further, I have no financial relationship with any or incentive with any other organization. I'm just doing it at my own time. I'm not being paid by anybody, and I don't want to be paid by anybody anyway. So, and the basic housekeeping, don't give away your personal information. It's being recorded, and we put it online, and you guys know that. So you can ask questions, but don't give your date of birth or social security, please. Thank you. That was a joke, but we have to follow the rules. So about me, I have been in practice for more than 15 years. I'm an internal medical specialist as well as a kidney specialist. And you can look me up online. I mean, I think I get some good reviews there, so I wouldn't waste your time on that. So about Dr. Fazil TV show, we started last year. We were not recording it before. Now we're recording it. It's 8th episode, I guess. 8th episode? Yes. You can see this show also on the website, drfazilshow.com, on the laptop, iPhone, obviously on the website. And we're getting around 10,000 views a month based on from the different outlets. We also, you can see me, obviously. This show could be seen on the Health Tips TV, which are all over in the waiting rooms in our clinics. I'm like a nightmare everywhere. So we also on the Roku TV channel. Last time we checked, we were more than 2,000 downloads has been done nationwide. So generally, the patients which are here when they leave for the summer, they download and they pass on to their friends and families, and that's the way we are spreading throughout the different states in the U.S. Also on the YouTube as well. The show is available on YouTube also. Now let's go main topic. Okay, yeah, Health Tips magazine as well. So any content which I will just be discussing in today would also be available on in the magazine in a written format. So that's available in the lobby of most doctor's office in Yuma at this point. So how to stay away from the hospital? Well, the answer is very simple: stay healthy. And this is as simple as it sounds. It also has some steps need to be done on your side as well. And I'm going to walk you through that. So, well, the first thing is try to see something known as continuity of care. Try to see your own doctor because if you can. I know there's certain healthcare setups where the patient has, they go to see one doctor and that doctor is being switched and there's another doctor and third doctor and fourth doctor. And the problem with that model is that although you're seeing a doctor, he probably have no clue about your history because you typically get 20 minutes to be seen if you're lucky, and that includes documentation, focusing on the problem of the patient for that day and document, and then ordering prescriptions and any other things relevant to that visit. There's no way in the world they can know all about you in that 20 minutes. And that's where sometimes the mistakes happen. What we tend to do, like in our setup, that I have learned that, if I keep seeing the same patient or they keep seeing me, I generally don't have to go through their previous visits. I kind of like remember, and I almost remember what they do, what has happened in the past, what did work for them in the past. So that makes me, or I will say just not me, but any other medical professional in that position, a better decision. So that healthcare model where you have a consistency of seeing same provider whenever you need to be seen will improve your health outcome. That's the fact. And that will keep you away from the hospital because you wouldn't get sick. Also follow the doctor's advice. And I can tell you sometime it seems like, well, they're supposed to, or patients are supposed to, but it does not happen all the time. I'm going to give you some true stories. few years ago, I have a patient who came to me, young guy. He had severe anemia, and I suggested that he should have a colonoscopy done because whenever there's blood loss or low blood count in a man of any age, there should be a source of bleeding because they don't have a menstrual cycle, so obviously you have to look for a bleed. And he was in the EMT, and when you're EMT, you're kind of like hard to argue with because they're like, they're in the medical profession. They do a good job, but sometimes personally, they don't recognize that they are making a mistake. So there was an argument between him and me and kind of going back and forth. And I said, listen, you have to have a colonoscopy done, make sure there's no cancer or anything. And he said, no, I'm fine, I'm healthy, I don't want to do it. Well, to the point where, he left the room and walked away. But I think he went home and decided to go ahead and follow the advice, and he went and had a colonoscopy done. And then, unfortunately, they found a cancer. And but it was fortunate that it was not spread. And he was, he had a treatment done. Then one of those days he came to the office, didn't meet me for whatever reason, but left a nice note on the front desk with a basket of fruit and stuff like that, showing appreciation that it was a wise step which was taken at that time. But sometimes patients don't listen to me or listen to a provider. It's not just about me, but I'm just giving examples because I know what happened with me in my setup, so I can give you the true stories. So, so this morning when I drive in, I was, I drove through my clinic, make a left turn, and saw a person clinging to the wall, and I knew he was sick. And I could tell he was waiting for the doors to be open. And he came right in, was short of breath, and Christian, he's one of my associates right there in the sitting in the back seat. He brought him in, and basically, we have resources in our clinic where we could actually treat him more than a basic clinic could do. We could, do blood tests, we could do EKG, we could do, infusions and everything. So spent few hours, but he was stabilized, and then he decided to go home. And that setup kept him away from the hospital. So sometimes it's not just, just a doctor, but it's also the setup where are you being seen. So that helped. So my suggestion or my advice would be, please listen to the doctor. I have another patient which have a mass on the testicle. Two patients actually. One patient was a younger guy, and he had a mass in the testicle, and we decided to proceed and do have him seen the urologist, and he followed the advice. It was a cancer. Second patient, not very young, he had the similar mass, and he said, I'm not going to say that four alphabets, forward, what do you call it, four things, He said that I'm not going to do it. So, and I felt sad about it because it was a preventable condition, and I couldn't get to his mind that, okay, this is something we can prevent. And the only thing he didn't want to go to San Diego. He said, I wouldn't go to San Diego. And I can tell you in the past, we have a patient which wouldn't go to San Diego. I said, listen, I will pay you, I will put you on the Greyhound myself. And at that time, his, I think, son became available, and he had a cancer of the kidney, and we were successfully able to take it out. Nobody actually does those surgeries in Juma. So we have to rely on the urologists in bigger cities like Scripps or in Phoenix. So it becomes an issue for the patients to go to those facilities. But it was the fact that he did follow my advice in one way or the other, and we could prevent that thing. And I can go on and on and on, because we had one patient yesterday, was seen in the hospital, was sent to a doctor which was unable to do surgery, would have unable to do surgery anyway. She came to me, and we had to retrieve the record from the hospital, and it was a cancer on the kidney, and it was very diagnostic. It was like, was on the CAT scan saying it is a kidney cancer. And she said, I'm not going to do anything. And I said, listen, if you have to pick up one cancer, this is the one you pick it up, because this is so curable, so much curable. And took us, me and Christian, about half an hour to convince her and the family, and eventually we made a point. And we're going to follow up on that, but it happened. And here's the thing. The last patient today, when before I was going to leave, it was not on my schedule. The patient walked in, and he or she, and I'm not going to be more specific, dropped a PET scan report. And it was brought to my attention, and it says that very high likely lung cancer. I'm like, okay, we got to see this patient. We cannot let this patient go. And she wanted to go back home, and So sometimes patients do not fully understand, and I think it is not the patient's fault. It is the provider's fault. It is because sometimes they're in a rush. They're not able to educate the patient well. So I don't blame patients for that. I think it is a rush mode, or providers trying to sometimes skip things, or not looking into the power of the education. Because the provider can't do it alone. It is a teamwork between the patient and the providers. But they will only understand if you educate them, because they're not doctors. So good communication is important. That will keep you away from the hospital. Okay, so other good thing, if you want to stay away from the hospital, is bring your prescription bottles with you every time you go see a doctor. And I can tell you, over and over, we see how many times there are mistakes in the medical records at the prescription level. Because generally, it's how it comes. Medical assistant asks the patient, is your prescription the same as it was last time? Patient says, yes. And half the time, it is wrong, even if it was wrong in the first time. So then, if the providers are busy or they're not very careful, they rely on the list, which is not accurate. Sometimes they can prescribe the duplicate medication. Sometimes they can provide a medication which might have drug interaction with your current medication. So there was a data, they said that 1.3 million people are injured by medicine error every year in the US alone. 1.3 million people are injured just by the prescription errors. So please don't bring the list, bring the bottles. We call it a brown bag day, not a groundhog day, brown bag day. Put all your prescription in the bottle, in the brown bag, and bring with you, and give it to the doctors, because that's the only way we can see what medications are duplicated, what medications are really you guys taking, what you shouldn't be taking. So that will help to avoid that fatal error. Trust me, that is the most important part of your visit, when you bring in your own medication. So please don't bring the list, because notoriously the lists are also wrong. So bring all the medication, including your vitamins and supplements and herbs and all the over-the-counter medication. Important, please bring with you. Early intervention. So I've seen sometime the patient wait too long. Now you have to know there's a certain viral infection. If you don't cure them or don't treat them within 48 hours, the medication would not work. For example, shingles. For example, flu. There's a window of opportunity, first 48 hours. You got to treat, so early intervention is important. As we all get older, the immunity drops. The healing power is not as much. Also from the children, and for the not very young, the immunity is different. So this is on the low side. So chances that it will get to the next level is very high. Especially if you have comorbid conditions. So if you're feeling sick, that's when you should be seeing doctors. Generally, when I have a no-show on a schedule, I say, and I will call the patient and say, they generally say, I'm too sick to see a doctor. That's actually a paradox. When you're sick, then you should be seeing doctors. And I think there's an issue with the delivery of the healthcare. And the issue is that obviously patient is sick and unable to see the doctor. In old days, you used to call the doctor, and the doctor will drive on the bike or whatever it will drive and will come to your home, right? And then modern medicine kicked in, and now we have this front desk, and you have doctors, and you have a back office, and you have medical record department, and you have prescription department. And so much moving parts in this whole operation that it's not possible to deliver the healthcare at home. But things have changed recently. Now we are 360 degrees again back. Now the emphasis is on the also on the home visits. So we did hire a nurse practitioner which will be able to do just like that. So if somebody called and said they took sick to come in, we can have somebody to come to your home and deliver the healthcare. So that's actually is another way to keep you away from the hospital. So one way or the other, you get your care, and that's the future of the medicine. That's what I'm seeing, because the care at the hospital is too expensive. Sometimes it's unnecessary. Sometimes it has other issues, caveats, errors. Hospitals are too dysfunctional. They're too ancient. They're too big, too heavy. So they don't adapt to the technologies as things change. So any healthcare system which can follow the changes can deliver a better health and inexpensive health. So that's important. So that model will keep you away from the hospital. And then we're going to talk about why should you stay away from the hospital. I keep saying don't go to the hospital if you don't have to. I'm not saying don't go at all. Sometime you will have to go, and there's a time and place, and I understand that. But if you can avoid it, that's fine. If you're not sure, yeah, okay, that's fine. Don't take a chance to go to the hospital. If you think it's a life-threatening situation, need to go to the emergency room, please go. I'm not against that. I'm just saying there's a few steps you can take to avoid that situation. It's like avoiding an accident. Put the seat belts on, have the airbags, the cars with the airbags and everything, right? We all avoid accidents, but it still happens. But we can lower the incidents. We just mentioned a lot of interventions. If you're, if you look at the changes in the healthcare delivery mechanism, infusion centers or having infusion in-house is a big deal. I mean, it can prevent. You go to the hospital for pretty much for the same reason. Like mostly, it's going to be if it's not a surgery, it's going to be intravenous fluids, antibiotics, other medications. And if you can deliver that thing at your clinic, you can also prevent that hospitalization. So now the question is why I'm saying to stay away from the hospital. The first few slides were, don't, and now I'm saying why. So it has been documented that one of the most dangerous the places for your health delivery is the hospital. Studies after studies has been done. The best thing is the prevention. So prevention is better than cure. And sometimes you don't get a cure, you just get the treatment. So now I have to look, I can read from here. So in 2011, Scientific American said that 200,000 Americans die of what are called preventable medical errors. Mostly happen at the hospital. The other reason is that there's numerous reasons why those errors happen at the hospital. Unsterilized instruments. One of the lowest paid and least trained employees at the hospital is the person who's in charge of washing and sterilizing dirty instruments. So obviously, that person might not be very interested in doing the job, but that's the most important thing to prevent infections that can change the outcome of your health. So you have to know what's really happening in the back end. Wrong drugs, wrong dose. I was a resident in my Brooklyn, New York, Long Island College Hospital, and there was a resident, and I think the doctor missed a decimal. So instead of saying 0.125 of digoxin, which is very potent medication, she read at 125 microgram of digoxin, which is, 100-fold more stronger. And she wanted to deliver that medication, and she did. And the patient died. And it was unfortunate. But again, those errors are happening because, there was no mechanism in place in the hospital to identify that problem. So wrong drug, wrong dose can kill you. Be aware of that, please. Wrong site surgery. And now, believe me or not, it happens all the time. Not all the time, but happens quite a bit. And it's not reported. So it happened 867 times in 2009. And it seems like it's much lower than the real numbers are because hospitals don't have to report that kind of error. They are not required by law. I mean, there's no law in place at this point that they have to report it. So there might be a lot more incidents where you went for the right foot infection, they cut your left foot, and now you have an issue, right? And then the germs. Hospital-acquired infection. About 99,000 Americans die of hospital-acquired infection. MRSA. MRSA is a very strong, is a superbug. Once you get it, it's very difficult to treat nowadays. We used to use vancomycin, and now vancomycin doesn't work, and now we have Zyvox. Zyvox doesn't work, and we're looking for other medication. But that bacteria keep getting stronger and stronger because a lot of antibiotics are being used. So those bugs stay in the hospital. When you guys go in there, you will get that. And went for something simple, now you have something very complicated. It happens all the time. I can tell you some of you will have had experience of having MRSA infection from the hospital, right? I'm sure some of you have it. So hospitals are breeding grounds for those superbugs. And again, the reason is, a lot of sick patients come in there, they bring those bugs in there, and then it spreads through the hospital employees. Okay, this is a real picture. You can see there's somebody left the scissors in there, Actually, I saw a patient the other day. We had a patient who had a kidney transplant years ago. And I was seeing this patient for weight loss, and I think she complained of abdominal pain. I don't know why we did an x-ray, I forget, but I think we did an x-ray. And she saw the x-ray herself while the technician was taking it, and she saw a lot of clips all over her belly. And she took a picture with her cell phone, and when I went to see her for the second time, she said, "What do you think about this picture?" I said, "Yeah, there's a lot of foreign bodies in there. Whose picture is that?" She says, "It's mine." I said, "Oh yeah, you have a kidney transplant there. Somebody forgot all the metals in there." So now we're trying to find out what need to be done at this time. Should we leave in there just like when sometimes you have a bullet wound and the bullet's left in there? But that's not supposed to happen because that wasn't a war injury. It is an elective surgery. You shouldn't be doing all that, But it happens, and this is the picture right in front of you. Okay, so 10% spike in fatalities at teaching hospital in July. Studies have been done. So don't get sick, or if you get sick in July. Now, you have to remember, the teaching hospitals which have residency programs, and it seems like a good thing, right? Like, teaching places are supposed to be like nice and good. It's not. It's not because they're teaching the students, and there were studies done since the residency starts in July of each year. The new interns comes that year, like July of that month. So they have no training. They're just starting. You guys are guinea pigs, right? In one way or the other at that time. Eventually they get better, but they have to make some mistakes. So don't be their mistakes. So again, seems like a good deal being in the teaching hospital. It might be not in July. Don't get sick in July. Try not to. Don't get elective surgery done in July. I know you can't prevent a lot of things, but if you can choose your hospital. Choose your hospital wisely. Oh, here you go. Choose your hospital wisely. And social media is very strong media nowadays. Watch for the fake news, but you can still find all your reviews about the what hospital you're going to go. There's a lot of outlets out there. You can find the source. Go to, and your primary care doctor will be able to tell you. Like I tell all the time, if you need like for example, urological surgery, I tend to send them to bigger hospitals like in Scripps or in somewhere in Phoenix, because we don't have that resources available here. So your primary care doctor is probably a better source as well, besides the social media. Oh, says no to Fridays and weekends. So the study was done, stroke patients treated in hospital on Saturday and Sundays were 16% more likely to die than those treated on weekdays. Happens all the time. Guess what? When you what happens on the week on the Friday? Everybody's rushing, the doctor's rushing, the staff is rushing away. But you don't have a choice. I mean, you didn't ask for this illness. It just happened on Friday, right? So trust me on that. I know the behind the scene things, how things work. You are a bad news for them. They don't want to see you that day. Weekend, they don't want to see you that day. And the reason is, even if they want to see you, they can't, because generally there's a call schedule. One doctor is covering 5 different doctors, and they're running around. They're just trying to cover those 2 days so it should be over, right? So even with the best intentions, that person's still a human being. They're going to make human errors, right? Because if you were seeing 10 patients, for example, or 15 patients, now you're seeing 70 patients that day. There's no way in the world you can give the same attention as you would do on the weekdays to your own patient. So if you have a choice, don't do elective surgeries or elective admissions on Fridays and on the weekends. Try to do on the weekdays. You will make it. And then few other things we have to be careful. The elevators in the hospital are more dirty than the restrooms. You know why? The restrooms are cleaned regularly. Elevators, they're not. Not those, the keys, they're not cleaned regularly. So if you press the button, you got the bug. So that's how it goes. So try to clean it up. Oh yeah, by the way, the doctors with the tie. See, I don't wear the tie on my days of the clinical days. And there's a reason for that. I mean, I used to do that, and when I found the study that there was a study done in that doctors with tie or necklace. In 2004 study, 20 out of 40 doctors' ties were found to be contaminated with dangerous bacteria. So what happened? Doctor have a nice tie, looks smart, comes in to examine you, bend over, the tie rubs against your chest or your mouth or something. Then he goes to the next patient, does the same thing. Now he's actually transmitting bacteria from patient to patient to patient. So that's so the doctors with the ties, not today, doctors with the ties are very dangerous, okay? So just try to watch out for those ties. And that was end of my presentation. Thank you so much. Questions, please. Thank you. All right.
Dr. Fazil, the last several weeks we've been seeing a lot of information on television news about measles. And there is a group of people, I guess, in the United States that do not want to inoculate their children. Could you give us your opinion about that situation?
Well, like any medication, there's side effects, and risk and benefits. So the benefit of getting measles inoculation is a lot more higher than the downside. I mean, if you look at any insert of medication, if you start to read it, you will never take a single medication, right? I mean, it is start from flu-like symptom to explosive diarrhea. Let's say, who's going to take that kind of medication? If you take it, you can have one of those things certainly. So I think it's a misinformation among those group of people. It might be a religious reason, or it might be a lack of knowledge of medical education, because if 1 in a million will have a side effect, that doesn't mean that you shouldn't be giving inoculation to your children for the fear of that thing. So So if something's new, I understand there's always a downside. You don't never know. For example, the strong flu vaccine came in recently, and a lot of people got sick with it. There was like a strong strain vaccine. But measles vaccine has been in the market for years, decades and decades. And we know it is more beneficial than not. So I think they should get educated, and they should allow their children to get the vaccine for that. So I think it's a misinformation and special groups, I guess. I don't know. Yeah. That was a good question. You always ask great questions, so it's an interactive session, so yes, I think you have a question.
I asked you a couple of weeks ago when I was in to see you about if you had had a vaccination for the measles as a child, were you inoculated for life? You said yes, and then I recently heard that on television too. They were saying that. A doctor on TV had said that. What if, like, for instance, older adults like us, we have no medical records to know for sure that we had that vaccination? Should we get another one?
Well, generally you can check the titer. You can check the titer in the blood. There's a very we commonly do it. Some high-risk profession, they actually require to check the measles titer in the blood. So before we start to give vaccinations, I think we should check the titer. And if you already have it, then there's no need for that. So that's what I would do. I mean, the titer might drop over a period of time, but it shouldn't drop. And if you are not sure, I will just check the blood test, and you can find out if you are immune or not. Good question. All right. Any other questions? I'm a Pandora box. I mean, once I open, well, that was a very good question. Great question, actually. And people in the back rows? Great. Well, I think that concludes our session for the day. Our lunch is ready. Let's have a lunch, and thank you for coming in. Oh, before we conclude, the next session is on May 31st, Friday, how to come alive out of the hospital. This is the next session linked with that. And it's true, it's going to be very informative, because first we will try to prevent you to go to the hospital. And if you did end up in the hospital anyway, there's a few measures you can take to stay alive and come out alive. Trust me on that. There's some hospitals have a one-way door. You go in, you never come back, They have a mortuary in the backside. So I was actually going other day, and I saw a billboard saying, and I wouldn't say the name of the company because, we're being on the bigger channel now. So it says, from your family to our family, and blah, 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 mortuary. I'm like, thank you very much for making my day, So we don't want to get there, because, once you go to the, to the doctor office, if you didn't make it, then you went to the hospital, you didn't make it, you end up in the wrong place, So we can prevent that chain reaction by not going there in the first place. And if you end up going there, I can give you 10 steps where you can safely come out of the hospital, okay? So thank you so much. We'll meet you again, and have a nice day, and have a lunch, please. Thanks so much. All right, great. Thanks.